there's more and more evidence that young people, teenagers in our society, are actually harming themselves, often cutting themselves on their wrist generally. In fact, a UNICEF report from 2 years ago suggests that 65% of South African young people have some form of mental health. Dr. Terri Henderson is a child psychiatrist, a member of the South African Society of Psychiatrists. Dr. Henderson, good afternoon to you, and thank you for your time. Why do young people do this? What is it about the act of cutting yourself that drives them to it?
Okay, so cutting is the most common form of self-harm, and teenagers do this, what may seem a rather unusual thing, as a form of coping with overwhelming emotions. So it's hard to see why hurting oneself could be some sort of remedy, but the act of cutting, which is usually on the inner side of the forearm, is about releasing tension, about physically actually seeing cuts and scars in some way externalizes what they feel emotionally. The pain I feel here is what I can see there. It often releases tension. It gives teens sometimes a sense of control of otherwise very uncontrolled emotions. So it's used as a coping mechanism for a teen who doesn't have other means of support. It's not a coping mechanism we want to encourage, but it's the kind of coping mechanism that is a clear message that a teen needs help.
So what kind of help do people need? I mean, if someone comes across this, and often if you ask a teenager, have you cut yourself, they're not going to tell you that they did it. How do you help them?
Well, it depends who's asking. So usually the sort of discovery of self-harm comes down the line because teens will do what they can to hide it as much as possible. So they will wear sort of long sleeves no matter what the weather is to keep this secret. And that is out of fearing people's reactions if they were to see it, especially parents, about being judged and being ashamed of it. If as a parent you do come across this, I think the first step is about managing your own reaction to it, which often I would imagine is a bit of a shock, and wondering why is this happening and why is my teen doing this. I think very simplistically, if a teen is self-harming, it's a very clear message that they're not coping, and it's a very strong physical way of saying, I'm not coping and I need help. So a parent or an adult's first intervention is to acknowledge, okay, what I'm seeing here tells me that you're battling and you need some help. Parents, importantly, are not going to take this on and fix it. We don't fix things in teenagers as parents. We parent and support. But it would be to say to that teen, okay, look, obviously you are battling, so let's get you some sort of help. First sort of stage of intervention would be, for example, a GP just to do a general assessment of mental health, where that teen is in terms of their broader mental health, in terms of depression or anxiety or trauma or substance abuse. And then the interventions required really depend on the severity and what else is happening in the case.
Dr.
So,
I'm afraid we'll have to leave it there. It's a very important topic. Dr. Terri Henderson, thank you, a child psychiatrist, member of the South African Society of Psychiatrists.